We're in the room full of pharmacists. So the question is, what are your roles in this journey to end HIV epidemic and improve the quality of life of older adults? One key thing that you can do is optimizing medication regimen, like I stated earlier, because you're the one who have the full picture of what patients are taking. You want to be able to not only educate patients about the side effects of their medication and drug-to-drug interaction. You want to be able to pick up the phone and call the prescriber while you're talking to the patient, because you will agree with me that sometimes when you discuss with patients, say, talk to your provider to say, oh, change this medication. When they leave that pharmacy, they're going to forget. But if you're able to call the prescriber and say, this is what I'm saying, what can we do to have a better option for this patient? And the provider can get on the system and make those changes immediately. Of course, patient education and adherence, while the provider or the prescriber is educating patient on the importance of adherence, when the patient comes to pick up this medication, we want to take a moment as well to educate them. Also, reinforce that side effects of medication or drug-to-drug interaction. Pharmacy becomes the last line of defense or last line of action in terms of educating patients. Another thing is addressing the stigma by advocating for the patient. When a patient comes to the pharmacy, you don't want to be asking what's your date of birth in front of everybody. You want to have a safe space where you can bring the patient, discuss about this medication, discuss about side effects. They can't be mentioning the name of the medication in front of everybody, because some people might know what it is and know that this person is living with HIV. So having a safe corner where you can privately discuss it and make sure that the medication is not put in a transparent bag, which I know most pharmacists now don't put the medication in transparent bags. Those are the things that help decrease the stigma. Of course, advocating for holistic care. So, in conclusion, managing HIV in older adults has its complex challenges. And this is because in older adults, there are a lot of comorbidities because they're now living longer. So it is important to have a psychosocial consideration, pay attention to their mental health, provide social support in terms of managing this mental health. And this can be done with a multidisciplinary care approach. So where the pharmacists, the other healthcare team will work hand in hand in addressing patients' concern and addressing all these comorbidities, as well as making sure patients stay adherent to their medication. HIV is already a burden to a lot of people who are living with HIV. So it's our job to make it easier for them so that they can keep living longer and healthier and full of life. So thank you.